I'm Rachel Prowse. I am an assistant professor in the Faculty of Medicine. I am in the Population Health and Applied Health Sciences division, and this division trains graduate students, and some of our programs are practice-oriented. So I am the program coordinator of the Masters of Public Health, Nutrition, and Dietetics program. So in that program, we are training individuals who will become registered dietitians, so an actual allied health professional, but it's also alongside our general Masters of Public Health program that trains public health practitioners in general, which can be widely employed across different sectors after graduation. So just some context to kind of where we're coming from. So I worked with CITL on a podcasting assignment last semester in the fall. And because of that, I was asked to maybe just share my experience. So I am not well versed in this, but I have done it once. I've done some thinking about it. We've seen how it's gone. So definitely happy to share my experience. But you might be coming from things from a very different perspective. I can't see the chat anymore, Darlene, so feel free to just unmute if there's something happening. Okay, so what I'm hoping to do today is just, again, share my experience of incorporating a podcast assignment into specifically a graduate level course. I haven't done a lot of undergraduate teaching. Graduate coursework is what we do, mainly in the Faculty of Medicine's beside our undergraduate medical school. And so you might need to think about how maybe it could be adapted to undergraduate courses. And I'll include some recommendations, if you're just considering this type of assignment. So how we're going to accomplish this, I'll give you a bit of a background that just situates, why did we do this assignment? We'll go through some details of the process so you can actually picture how it would happen. I'm going to talk about the outcome. Was it a quality assessment strategy? What did the students say about it? And then we'll summarize. So the course that this was included in is called Professional Practice, which might not be, the traditional technical type course you might see in sciences or humanities. It might be, more relevant to some business things, but at any rate, this course is very much these kind of building some really transferable skills for students, and this is particularly important for health professionals. So we use a variety of methods. So we do presentations, we do a lot of discussions, we do panels, we do workshops. It's very hands-on, and the topics we cover are an interprofessional approach to healthcare, professional ethics, mentorship and preceptorship, conflict resolution, and written and oral communication. At the heart of this is about professionalism and reflexivity, and it's really an opportunity for our graduate students to kind of like dig deep and figure out what kind of practitioner that they want to be. It highlights blind spots in students. I see incredible growth with these students. So it's a really neat course just to begin with. And it just felt like a podcast assignment, just kind of fit as something different, another way for students to kind of try and express themselves. So again, the goal of the course is those soft skills, communication, ethics, personal reflection, and professionalism, transferable skills. These are based on competencies that are required for registered dietitians and public health practitioners to learn in their academic training. A little bit more generally, if I think about what is it? Why did I choose to do a podcast in particular? It's because this is what I told the student. I really wanted them to practice talking about difficult topics. Whether that's conceptually, scientific, emotionally. Don't do as much oral communication, I don't think, in school as we need to when we sit down in meetings and have to actually articulate ourselves. We've gone through years of students presenting, unfortunately, like this in person, where they're staring at their slides and they can read off of it rather than being very, very efficient. So I wanted them to practice asking questions. I wanted them to get comfortable with the uncomfortable. So that was kind of the bigger philosophical approach to it. But the other pieces that I was trying to accomplish is, I mentioned there are dietetic and public health competencies related to oral communication, Reflexivity, highly emphasized in our program, oral communication, this aspect of being comfortable thinking on your feet. And it wasn't about, my goal for this was not about them trying to create a quality podcast, but you'll see maybe it should have been. Maybe I should have emphasized that a little bit more. It was really just discussion and facilitation and oral communication. That's supposed to be Chat GPT. I also included this as just another way to assess students' learning that didn't feel like it was going to be threatened by Chat GPT. I think we're all probably experiencing unknowns with that, trying to figure out exactly how we redesign our courses to protect from AI or plagiarism. And so that definitely was a major reason why I wanted to go with kind of an oral assignment and a assignment that required different components. So just to preface it, if this makes you feel better or not, I have no podcasting experience. I'm not tech savvy. That's not at all where I came from. I have done lots of media interviews over my career in my area. And the students also receive media training in our course. But me having an experience in this, that there was no foundation of that. So hopefully that makes you feel better. If you haven't done that, you still can do it. So the assignment strategy was that students would prepare a podcast episode on a controversial public health topic. So that gets at that challenging, uncomfortable topic. I specifically assigned substance use. And I specifically did that because we had a new faculty, Dr. Jillian Cola, who's an expert on this, and she was willing to kind of be the expert that they interviewed. So I already did the steps a little bit for them. I wanted them to think about it from a professional practice theme, though. So it's less about the content and more about the reflection on how do we practice in this area. So the steps were that in a group, they would facilitate a discussion with Dr. Jillian Cola, and then they would take that interview. Each student would take it individually, and they would create an introduction and a conclusion, and splice together different pieces to create their own podcast. So although all students had the same interview, they all had created their own podcast in the end from the interview. So, these are the detailed steps that the students saw, but this is how we accomplished it. So they were assigned to prepare a list of questions so that they came in already doing some thinking on it. This was a really good practice for them, thinking of some open-ended questions. I gave some examples to them. On a different topic, gave some direction here. They actually worked as a group so that they didn't all come in with the same questions. We scheduled a time with a backup date. We never know what weather's going to be like. You never know if people are going to be sick or how you might do it, where the actual interview was going to take place. And that occurred at CITL at the podcast studio. And in that session, the students took turn asking questions. I only have 3 students. It's a pretty, tight-knit course. So again, maybe completely different if you're thinking about this for a class with 80 students. But each student, they facilitated it collectively, but tried to at least share that time. So cumulatively, each student would facilitate for approximately 20 minutes out of that hour. CITL recorded it in the studio, and they sent an MP3 audio file. What the students did individually, like I said, they reviewed what I'm calling the discussion, that interview, identified, this is their main assignment, 1 to 3 key themes about substance use and professional practice. That's how we're linking it back to the course. And so there were some kind of examples that were given there. So then they would take the discussion and splice segments that show their theme, that evidence of theme. It doesn't have to be the times that they were asking questions. It could be anything. And then again, record that outro and that intro and outro that explain the themes that were coming, the significance, their reflections on them, and whatnot. They also used Audacity, or they could use another audio editing tool to splice all those pieces together to end up with a podcast episode that was 10 to 15 minutes long, and they just uploaded that directly to Brightspace, and then I could download it and listen to it. So, a couple things to think about, but, once you're going, it's pretty straightforward. This is a required preparation by myself. I met with CITL to plan this. Again, this is entirely new to me. They have far more expertise. We booked that studio and staff time. So we talked about different dates. We had the backup date. We also had a date before it to actually tour the students. So I think I went independently, and then I brought my students at another time, and they actually sat down in the podcast episode or studio. They got familiar with the mic and how everything would sound, wearing the headphones, so their breathing didn't throw them off next time. And they would learn if you need to cough, you might move away. And so that really made them quite excited about it. I also, like I said, recruited and scheduled an expert. You wouldn't have to do that per se. You could do this without an expert. The students themselves could make all the content. But when I was thinking about it, I was like, I think I want them to engage with an expert. I prepared the assignment guidelines, and I prepared a rubric with support from CITL. What the students were required to do, they toured it, they tested the equipment, like I said, they reviewed background material. So substance use might have sounded kind of out of left field when, I come from a nutrition and dietetics perspective. But we see a lot of the work in public health nutrition is poverty reduction. So it's not that far from, from practice, and relevant to other students who aren't dietetic students doing general public health training. So they wanted to feel prepared. So they reviewed background material that Dr. Jillian Cola provided, and they actually attended a guest lecture from Dr. Cola in advance. And so they felt really prepared. They had lots of really informed questions to ask. They downloaded the software that was required, and they did their intros and outros and did all the splicing themselves. So all the kind of technical pieces they were assigned to do. So the tools there that were needed, CITL, your biggest tool, and so source of support there. Basically, once you have it organized, it just runs smoothly from them, and help draft that rubric, since this wasn't an assignment I had done before. The Audacity tool was what was used to upload the MP3, and then students spliced it together, which you'll see their feedback there. They didn't feel it was overly easy to start with, bit of a learning curve. So they'd be open to learning other tools, but also might come from the type of background, the students don't have any experience in this either. So I wanted to just share a couple excerpts just so you could maybe hear it. One, because I think it's quite cool. Two, you could kind of get some sense of like the audio quality. So there were 3 podcasts that were created from it. The students could go back to the studio to record their intros and outros, so you could have the same kind of quality, but they just recorded them like on their own computer, etc. So, I mean, you can hear that a little bit, but again, the quality of the podcast was not what I was going for. It was much more getting them to practice oral communication, and thought it'd be fun to do it within a podcast. So I'll just share a couple snippets. And Darlene and I tested this earlier, so we think you can hear it, but if you can't, just let me know.
Hello, and welcome to our podcast, Prescribing Equity, where we discuss complex and controversial topics in healthcare, public policy, and social justice. My name is Alaya.
I'm Melanie. And I'm Becca.
And for this episode, we had the privilege of sitting down with Dr. Jillian Cola, a public health researcher and part-time professor at Memorial University. In our discussion, we will be talking about the stigma around drug use and people who use drugs, and how this stigma impacts evidence-based practice in both policy and healthcare. We learned that while there is evidence that certain interventions and policies will reduce harm in this population, persistent stigma against people who use drugs really blinds both policymakers and healthcare workers to implementing evidence-based policies and care. Dr. Cola brings a wealth of knowledge and insight into this topic, and we were so lucky to have the chance to speak with her. Let's get into it.
So that one was really has a really smooth intro, I think. Elia is quite well spoken. She spliced, you can hear that they spliced different things in. So she spliced in each student doing their introduction quite well. I'll just go a little bit later, closer to the end. So closer to her outro, which you can hear the end of Dr. Cola's and a bit of Elia's kind of final thoughts.
I honestly learned so much from that conversation, and it made me so much more aware of my own biases towards drug use and how society and my own upbringing has shaped my view of people who use drugs and drug use in general. And we talk a lot on this podcast about evidence-based care and practice in all areas of public health. And unfortunately, due to deep-rooted stigma, this doesn't seem to translate into the area of drug policy and providing care and harm reduction to people who use drugs. And I think when it comes to moving forward into more evidence-based interventions in this population, people like Dr. Cola are really paving the way. And yet I believe we are all responsible for taking the time individually to sit with our own assumptions and biases, even though it can be quite uncomfortable, so that when we do interact with this population or provide care, it is from a place of empathy and understanding rather than stigma and discrimination.
And the last one I'll share is you didn't hear any of Dr. Cola there, but Becca kind of jumps right into asking questions, so you can hear a little bit of the quality of the podcast. I think it's around here. I might flip back and forth a bit.
So that I can provide them with the best possible care. At the end of the day, we're all human beings, and we deserve to be treated with kindness in our most vulnerable moments. With that being said, take a listen to our conversation. So you mentioned that you work with people who are actually substance users. Can I just ask, what does that look like? What kind of a role do they play in your research and your work, and how crucial is that role, and how are they actually taking part in that?
That is a great question. So what I like to do is I like to have advisory groups of people who use drugs, who are folks who I've usually worked with before, who, are people in the community who are really, really interested. There's a lot of folks who want to give back. There's a lot of folks who are really, really interested in figuring out how they can themselves help, because they have so much experience with the different systems.
So you could hear a little bit of Becca's kind of intro and then flip to a slightly different level of volume, but you can also hear her splice right to a question, and you can also hear her trying to get a question out in a conversation. So I just wanted to share those kind of as snippets. You might not be interested in them if it wasn't your area of interest, but also just hearing Elia talk about, which was this one, about her addressing her own biases and assumptions, that. Well, you see kind of the outcome piece. That is what I really wanted them to get out of this assignment. So it's really neat to hear them talk verbally about it. And I can see, now that I've had these students in future courses, you can see their confidence in sitting in class and challenging a thought or trying to communicate, being more comfortable trying to communicate something that they haven't fully figured out in their brain yet. Whereas when you're writing, you have so much more time to be reflective. But sometimes you're not even quite getting there, because you can hear it even right now that I'm struggling to find exactly the words that I want. So I think it's really helpful to practice this kind of oral communication for these types of focuses. So I'll go through a few more slides here to kind of show you the outcome. Oh,
and uncomfortable. Hey everybody, welcome to the Wicked Web.
Oh,
we invite.
This is crazy. I'm just gonna try and go to the next slide. Okay, there we go. Sorry about that. So, at the end of the day, you want to know, did this actually meet your needs? Was this a valuable assessment strategy? So you can see some pieces there of the different criteria we were included in the podcast assignment. So these were based on the instructions that the students provided. The most important, these aren't clearly weighted here, but identifying insightful and, themes that had thorough explanations were a crucial component of it. And then not just stating those themes, but providing supportive information to really interpret that. And then the use of interview material to demonstrate the theme. The kind of organizational piece of the podcast comes into the coherence and the intro and the outro there, so that the coherence is that when the students splice things together, did it still follow a logical conversation, or were there things missing? And then that the intro and the outro really well set up the content and well summarized it in the end. So what I saw from the students is that they were effective at being able to pull out themes, and the themes were different between the students. So each student, even though they all did the same interview, they took different content away. The supporting information piece, I didn't get as much as I kind of had hoped there. And same with, there was some challenges with the use of the interview material. And this was just that they really loved hearing the expert talk far more than they heard themselves talk. So there wasn't as much kind of personal discussion in the interview. So they ended up just kind of splicing long chunks from Dr. Cola, which is fine, but they really struggled to kind of take individual segments, and then they didn't add additional things to it because they kind of really felt like, Dr. Cola said this and nobody can say it any better. So, like I said, really good at themes, but the actual, what I expected to see around them kind of describing things a little bit further or splicing things together better, there was still something to be desired. But clear, very coherent. The outro and intro messages were really well done. So I think the gaps that I have here are more about possibly my instructions to them, or possibly the style of having an expert interviewed. And I maybe not, now that I've listened to them a couple times preparing for this presentation, they may have been doing more splicing than I thought. And I just saw a comment that they might have defaulted to being hosts, and I think that is a very good way of putting it, as opposed to them generating content. So that's just something I've reflected on now, that I will repeat this, but it will have to be designed a little bit differently. So maybe not an expert, or maybe they do an expert interview plus some time for them to kind of debrief about what they heard. But the students really enjoyed it. And that's a big thing for me, because I did find that they learned some really important things that I needed them to learn, and they liked it. So when I got some feedback on how they enjoyed it, they said that just the actual experience of doing it, real life experience, being in the studio, working in a group, learning a new tool, they really, really enjoyed it. And when I asked what you learned from it, they said that they were learning those things around how to ask open-ended questions, how to ask a follow-up question, being more comfortable, having more confidence doing that, how to identify themes. So all of these, I think, are definitely in line with the goal of improving oral communication. They also said that, they enjoyed how to edit, but it also was a challenge for them. So, the feedback I got from them is that editing was challenging. Maybe a different program would work. It just was a bit of a learning curve. Students are pretty busy. They left things to the last minute. That's just kind of how it is. I don't think, I've heard from CITL that Audacity is quite good. So, and being the best part that they said was, like I mentioned, being in the podcast studio. They really liked the subject topic. It was a hot topic. Discussing it with an expert, having that actual outcome of a podcast, seeing it all come together was really helpful. And doing these kind of experiences in a learning environment, they really enjoyed. So lots of positive feedback from the students. So I'm just going to end here with some take-home messages and recommendations, but really this is just a list of my thoughts at the end, because I think it really depends on the type of course you have, the type of learning outcomes that you have. But I think some things I want you to remember is that you really don't need to have experience with this, one step ahead of your students, and you can get this done. I think it's very useful for practicing oral communication skills, and it was a fun alternative to doing something written or doing an oral exam or a presentation. And students really like to have that actual product at the end of it. I've also seen people create, if they have larger classes, like a series of podcasts that are then, available online, and it's a bigger kind of deliverable. So you could think about this like, how does this fit into your P&T package? Like, can you sell this at all in terms of promotion and tenure and those kind of achievements? I thought it was worth the effort. It wasn't that much effort. I'm definitely going to repeat it. And again, just to emphasize, editing was the trickiest. So allowing students to work in groups kind of reduced some of that labor there. The expert was helpful, but leaves less time for students to talk themselves. And I think just getting input from the students, because they might have more experience with this. I had an idea, and I think we kind of planned a few pieces out together with the students, and that gave them some kind of ownership and autonomy. And so they just bought into it a little bit more. So that's all I have. I'm happy to take questions or comments. It was really valuable. Again, I'll probably do it again. Worked quite well for graduate level students, but I'm sure you could find a way to kind of adapt it to undergraduate. So thanks for listening. Here we have a question. How would you view the time differential in grading the audio versus another media? Yeah, that's a good question. So the students they didn't want their podcast to be 10 minutes. That's what we had initially said. And then we said, okay, they could be up to 15 because they had an hour interview. And then one of the students said, can it be closer to 20? Like there's so much good content here. So listening, it depends on what the other pieces are. Sometimes it can take quite long to read a paper, but if you're, reading a critical appraisal of a paper you're very familiar with, students are all kind of doing the same thing, should kind of include the same content, you can get fairly quick at reviewing things. You can't really speed up a podcast. Like we might all have a tendency to eventually start to scan written work of students, but you can't really skip through a podcast. So at some point it felt like it was a bit of a labor to mark, but they were also interesting. So I don't think that there's a huge difference in grading the audio versus another. It just obviously had more upfront labor to prepare it. That being said, I only had 3 students. If you had 80 students, if you had 50 students, 40 students, that is a reasonable concern. How might you do it? You could also, in that case, I'm never opposed to peer evaluations. You could get students to kind of grade a set of them, which just is kind of like another approach. You probably still want to listen to them, but also maybe you have TAs that could help that as well. Yeah, thanks, Heather. I think it is worth exploring too. Students are usually far more tech savvy than we are. Might save class time. So that might be an advantage to it, because you're not having kind of everybody, you're spending that time doing presentations. The disadvantage is not everybody hears the other students present, and sometimes it's really helpful. It's often very helpful for students who might struggle with oral communication, really hear a peer do a really good presentation, right? But definitely, I think we want to keep our students interested, and the same types of assignments aren't necessarily overly helpful in preparing them. I really appreciate the opportunity to share, but if anybody else tries it, please reach out, because I'd love to hear about your experience too, because it'll take a couple tries to polish it.